afternoon, sir. You called about a heifer?
Yeah, this is my old heifer here. Her name's Tasty. She's not looking too good.
Well, she does appear to be a little on the skinny side. Any changes in behavior?
Yeah. Actually, she's eating a little bit now, but she honestly hadn't been eating a whole lot here recently. She doesn't get very excited. She used to run over to the feed bunk, but now she just basically watches the other ones eat. She's got a really bad cough, and she's been breathing pretty heavily.
Well, let me take her temperature and check her respiration rate.
Okay. I'll hold her still. I'll try.
Well, she appears to be running a fever.
Okay.
Her respiration rate's not so great.
Okay.
So I would say she has BRD.
BFD?
BRD.
BRD.
It's Bovine Respiratory Disease. It's basically pneumonia for cows.
Okay. And how did she get it? And I guess what would you recommend we do to try to treat it?
She could have gotten it from numerous places. Most likely she got it from the weather changes that we've been having.
Right.
A calf her size isn't going to be able to cope with the temperature changes as well.
Okay.
Especially with the wet. And,
yeah, it's been really warm here recently.
And so that's since her immune system isn't as fully developed yet, she can't handle it as well.
Right. Okay. All right. So what is the actual reason you would probably say that she just suddenly sprung up and got BFD?
BRD develops as a result of complex interactions between environmental factors, host factors, and pathogens.
Okay.
Environmental factors like weaning, transport, dust, crowding, and poor ventilation are going to serve as stressors to the animal that are going to adversely affect her immune and non-immune response systems.
Okay. Okay.
Where do you have her housed at?
We actually keep her at a barn, right over there, just beyond that little field.
Okay. What's your ventilation system in there?
What do you mean by ventilation system?
As far as airflow, what all do you have going?
Okay. Yeah, so most days we open up the barn doors so I guess air can blow through, keep them a little cool. And we also have some box fans that are set up on top of the pens for the calves.
Okay. Well, certain environmental factors such as inadequate ventilation can enhance the transmission of the infectious agents among the animals. So the initial pathogen is going to, when it enters her, it's going to alter her defense mechanisms, and that's going to allow colonization of the bacteria down her lower respiratory tract.
Right.
And then after that initial infection, she's going to be much more susceptible to other pathogens.
Okay. Right. All right. So what's the plan, Doc? How we gonna treat old Tasty here for the BFD? BRD.
My vet tech's going to bring you some medications and explain how to use them.
Okay.
Is she housed in a pen with other calves?
Yeah. We keep her in a pen over there at the barn, which is on the other side of the field. We keep her with about 5 of the calves. Or five including her, so 4 of the calves.
Okay. If it's possible, you should probably try and isolate her for about 2 weeks from the others. That way, what she has, they're at lower risk for developing themselves.
Okay.
And keep a close eye on them because she's been interacting with them. They could possibly have it as well. It just hasn't shown up yet.
Okay.
So also, if you can get some more airflow through there, add maybe a couple more fans. That wouldn't hurt either.
Okay. So this is contagious.
Yes.
What she has. Okay. All right.
So.
All right. Well, I guess I can move something around and probably get some fans in there and see what we can do.
Okay. Keep us updated on Tasty and her friends. So.
Okay. And your vet tech will be coming to help us out?
Yep.
Okay. All right. Thank you.
Yep.
Have a good day.
You too.
What do you think, old Tasty? We'll get you all too.
Hello. Is this the girl with BRD?
Are you the vet tech?
Of course I am.
Yes, this is Tasty, which
She's
is
adorable.
chronically having BRD.
Okay. So, here are the medications.
Okay.
This is LA200,
LA 500?
LA200,
200.
LA200 is lincomycin. It's an antibiotic that'll help with her fever and if there's any other bacterial infections going on.
Okay. Okay.
You administer 10 milliliters every day in the neck subcutaneously for 14 days, so 2 weeks.
So for a month, every other day?
No, 14 days, so 2 weeks.
14 days. And 5 milliliters?
Every day. 10 milliliters. Every day.
Every day.
For 2 weeks.
For 2 weeks. 14 days. Okay.
Try to keep it so it's around the same time every day. So if it's easier for your schedule to treat her every morning, treat her every morning. It's easier to do in the evening than every evening, but once a day.
Okay, once a day. So probably try to keep it like 24 hours or so.
About 24 hours apart.
Okay.
That would be the best.
Okay. All right.
And this is Zactran. Zactran was developed by Zoetis in the past few years, and it specifically targets pneumonia-causing pathogens.
Okay.
So with Zactran, a simple injection of 5 milliliters subcutaneously in the neck one time will keep her healthy for about 10 days.
Right. Okay. So I only treat with this for like a week or so?
No, you treat it one time, and she shouldn't need to be treated again for at least 10 days.
Okay, so one time every 10 days.
Not really. So it's one time and she'll be fine for 10 days. If she has a flare up after the 10 days, you can treat her again. But she should be perfectly fine and not have any more problems, and you shouldn't have to treat her again.
Okay, this is a big bottle for just 5 milliliters?
10,
What?
or yes, 5.
5
milliliters.
Okay. How many would you say is in here?
There's probably about 100 doses in there.
100 doses? Okay, so that'll last me for 10 years?
Pretty much.
So after 10 days, this should clear her up completely? Okay.
That one will specifically target your pneumonia. LA200 will specifically target any other bacteria infection that could be going on.
Okay. All right. So, just let me repeat this one more time. BRD, respiratory stuff. I need to get the calves away from her
Yes.
for at least a couple weeks. Treat her with this once a day for 2 weeks.
Yes.
And treat her with this once every 10 days if needed.
Yes.
Okay, 5 milliliters and then 10 milliliters
Yes.
for this.
And then the reason that I gave you the big bottle is because BRD is something that can never go away. She will
Okay.
always have it, and her lungs will always be damaged.
Okay.
So she might have flare-ups or later on in life, but since she is this little and we treat her now, she shouldn't have that many problems later on.
Okay. Well, hopefully. I guess we caught it pretty good. So, all right. Well, thank you. I appreciate it. Tell your doc I said thank you very much.
Have a great day.
Okay. Tasty, we're going to get you